Good morning, Liberty County. We're here, July 1, a brand new month, to give you our, well, this time bi-weekly COVID update. We took off a week last week. And in saying that, my hasn't a week changed, having our stats changed since we met last. Just when I thought we were getting a handle on things, we're finding out that there are spikes even in especially in Georgia in the South. And there's some here in Liberty County also. So we just want to reiterate to you the importance of all those things we have been talking about that should be a commonplace to us now. The social distancing, the hand washing, of course, wearing the face coverings. And we're going to really concentrate today on a lot about the face coverings. You will hear from Mr. Kenny Howard in a little while. The City of Hinesville we'll have that discussion tomorrow. The County Commission will have that discussion next week. And we just spoke with a few of the mayors, and we're trying to make it a unified effort among the counties so there will be no confusion. But I guess I need to say that it does not, I am pleased to hear that if the City of Hinesville should make a decision tomorrow, it being the commercial center of the county, that will certainly take care of most of the business ventures.
Technical difficulties. Again, we're here, one band, one sound. We're working together with all the municipalities and with the Liberty County Courthouse. And the city of Walterville is back open 9 to 5. But we're asking that each of you when you enter in the building, please have your mask on, and we all can't enter the building at the same time. So we're working with you as you work with us. And what else I got? Census, please, ma'am, please, sir, while I'm here, please, ma'am, please, sir. Our census have changed a little bit, but we still need your help. We're in the 30s, but we need to get up to the hundreds, at least 50s. But the census are very, very important. I have some stuff on the table that the citizens is asking for. But if you would sign up for your census, we should be able to get everything you ask for. But we got to sign up for the census. We have a station inside City Hall. If you need help with it, please, ma'am, please, sir, stop by City Hall. At this time, I yield to the City of Hinesville, Mr. Kenny Howard.
Thank you, Mayor Baker, Chairman Lovett. Good morning, Facebook family. We appreciate you tuning in for this update on COVID-19. This is the 15th week, actually, we've been involved in this environment, and this is the 12th broadcast with Facebook Live at the county and the other municipalities, mainly the city of Walthamville. I want to talk a little bit about what we're doing in the city of Hinesville. Everything so far as our measures, our mitigation measures that we've put in place thus far, the wearing of face masks when you enter into the buildings, your temperature check, all those things have been going fairly well. We've done a great job thus far, very, very little incidents, if at all. However, as I ride through the community, I see and I notice that a lot of our citizens and visitors and guests in the city of Hinesville are not wearing masks. And if you are in tune with what has been happening on a national level, you see where the numbers of positive cases, so far as the virus is concerned, is just it's increasing exponentially. And as a result, there are certain states in the nation that are really considered hotspots now. And Georgia basically being one of them. You know, it wasn't too long ago, about 14, 15 weeks ago, where New York, folks coming from New York had to quarantine for 14 days before they can enter into certain other states. Well, New York has reversed that, where if you're going to New York from Georgia, you have to quarantine for 14 days. And other states falls within that category as well. And so, you know, the wearing of masks, this is simple. I mean, it's very effective. It's not 100% foolproof, but it can prohibit or prevent the spread of the virus. The respiratory droplets that occur from speaking, singing, and if you don't maintain social distancing, then that could happen. And the virus basically don't have any barriers. And so the city of Hinesville, I want to touch on wearing a face mask. You heard from the chairman. And for my council members and mayors who are out there looking at this, we have not made a decision as of yet. We are exploring these options. The mayor and I have had some discussions, and I've reached out to the council members. We have not had a consensus as to how we'll do this. I will be giving the mayor and council an update tomorrow as to the pros and cons of wearing or requiring the wearing a face covering for citizens of Hinesville or visitors for that matter. And so we are definitely doing all that we can do to help protect our citizens, our visitors, and those who are considered a vulnerable population, because at the end of the day, we are all in this together. And whatever we can do to help minimize the spread and the transmission of the virus, that is what the mayor and council is dedicated to do. And so we are very excited about this opportunity to continue to work with the county and the other municipalities. As I communicate with Fort Stewart, they have some provisions on Fort Stewart. Colonel Logan and I spoke earlier this morning, and they too are prohibiting, entry into their facilities without face covering. And we know that we are at the gateway in Fort Stewart, and we have folks that comes here from all walks of life everywhere, and so there's no way that we can basically control that. But what we can do is to help protect those who are here and those who may be coming into our community. So we are cautiously optimistic that we can put together some procedures and some mitigating measures that would allow us to continue to move forward as we deal with this virus, because it's a very fluid situation. We may be up or down today and may be up tomorrow. And so there is no consistency of what has happened thus far, and this is nationwide. And so we want to make sure that everyone understands the urgency of this and the importance of protecting one another. Thank you.
Thank you, Mr. Howard. I forgot my list there. I had several things I wanted to talk about this morning. So I like these folks too. Really appreciate your diligence with everything that's going on and being able to tune in this morning. Just on the health side update, and some of this has already been mentioned, our numbers do continue to climb some. We did get a briefing this morning from a district health director, and the Coastal Health District is moving back to an appointment-only type scheduling that's going on. That will start, in fact, next week. So this will be the last week that you can have the drive-up clinic at the locations. However, people that want to make appointments to get these tests done can do so by calling the same number we used before we gave you, but that number again is 912-230-9744. 912-230-9744. These will be drive-up type sites for appointments that'll be done throughout the Coastal Health District. You won't need to go inside. It'll be similar to what the free no appointment scheduling drive-up clinics have been in the past. Also mentioned that CDC did expand their list of risk factors associated with the disease to include cystic fibrosis, pregnancy, liver disease, and smoking. Also noted that contrary to past belief that most affected groups were closer to age 60 to 65, now it's realized that the older you get, that risk does increase. On a bad note, for the holiday coming up, also lowered the obesity mass index to 30. So those folks that may be a little higher than what their index numbers ought to be on obesity may suffer some consequences also. The chairman mentioned something about contact tracing. Locally, we've had to deal with that here at the county, as probably a lot of employers have, or certainly probably will. Encourage your employees to please participate with the health department when the Coastal Health District or someone calls them concerning the contact tracing event that occurs. That I can't emphasize enough how important that is, that they're able to trace back who they've been around in close proximity for an extended period of time, as they do that tracing backwards to find out who needs to be isolated and possibly who needs to be tested. The governor's order, he did extend his order again until August 11th of 2020, basically under the same terms and conditions as before. Those have not changed. Locally, with our operations, we continue to operate like we were when we last talked a couple of weeks ago. Screening is still occurring at the doorways of our buildings. Masking at this point is encouraged, although that may change in the near future. And limits on occupancy are still in place in certain areas. If you can, please call ahead to discuss matters that you may have concerns or need help with. We really want to try to help you with those without personal contact at this point, getting you what you need, and we'll do so to the very best of our ability. The Board of Commissioners is still meeting together with very limited accessibility to the public. Basically, only those persons who have an item on the agenda are allowed to enter into chambers, and even at that point must be socially distanced, and then are asked to kindly exit the chambers once their matter has been discussed. Matters involving public hearing items are being conducted under strict guidelines to include assignment of spokespersons where possible, staging for comment periods, and telephonic participation where possible. The meetings, though, I do want to mention, it's very important that the public stays attuned to everything that's going on in our government sector. The meetings are being carried live on our Facebook site and are being recorded. So if you're not able to watch it when it's occurring, you can go to our Facebook page, and those are there for you. We have moved, or will move, July 6th into a masking policy for county employees. That'll go into effect on July 6, 2020, after the holiday. Guidelines for staff conduct both inside the office environment and outside the office environment, traveling in vehicles, will be put into place. And so we ask you to be respectful of that again. We do, just as a reminder, while masking at this point is not mandatory inside our county buildings, it is strongly encouraged. If you won't mask for yourself, please mask for us so that we can provide those services for you. Recreation, we open back up most of our outdoor recreation programming, and that's gone really well. Really just want to reach out and thank the public right now for working with our recreation department and doing all that you've done to help do the social distancing and follow the guidelines that are there for those programs. That being said, we are beginning to look and try to put together some type of plan for possible fall programming. Now, those are mainly would be outdoor type events, football and soccer. And so we'll be having some discussion in the coming days with the commission over what that might look like, because those registration periods would need to begin in the August environment. And so we'll be looking to do that. I do want to take just a second and I guess give my own little pitch on the masking thing. And these are great. The masks are great. You don't necessarily have to have a high grade emergency room type mask like the healthcare professionals wear. In fact, if you even try to get those, you won't be able to find them much, and you can't really operate with them. So common surgical mask, if you don't have anything better than that, are fine. I do want to say this though. I was in a meeting a couple of weeks ago where there was a masking policy that was mandatory, and I sat in that with a mask on, and I counted the number of times that people reached up and adjusted their mask or played with their mask around their face. That is something you should not do. And so in part of the election stuff we do the masking policy and how to properly put on and take off masks and all kind of PPEs. Always have one of these with you in your pocket, because anytime that you're going to adjust your mask, take your mask on, or put your mask on or take it off, you need to sanitize before you do it. So before you reach up, great to wear a mask. Masking is definitely something that probably is going to keep us in a better stead with this virus. But if you constantly touch your face with your hands and get around your eyes and around your nose and around your mouth without doing something to sanitize, you're making a huge mistake, and you're probably even making it just worse. So with that being said, that's my little pitch. Please mask, if not for yourself, mask for us, so that we can continue to serve you. And I will yield back to the chairman.
Thank you, Mr. Brown, for that little class in service. And the same rules I need some kind of applies to the gloves. You peel your gloves from the inside out. You know, don't just take them like you do your winter gloves. You peel them from the inside out. And what we do at the hospital, we kind of make them fit into each other, then we trash them. So, but don't want you to have your gloves on and doing all those face touches. It's the same thing. You really negate the essence of what the gloves are supposed to do. In closing, I want to say this: when you talked about the increased numbers of COVID exposures, some of that's related to the increased testing. They're doing more. We realize that. But as citizens, I want to make you think about this. You know, and the young lady said this morning that even the Department of Public Health is running low on PPE, on gloves and masks and gowns and stuff. So is that because the public is being non-compliant? That's causing them to run low on PPEs? So are you contributing to that? And I hope the answer is no. The latest numbers I heard was 122 for Liberty County. I think that's that what you have, 122. So we're over the 100 mark now. All right. So I just want to bring it home to us. A young man visited me yesterday. Hadn't seen him in a while. Came by the day before yesterday, and he said, "Mr. Lovett, my granddad won't let me hug my grandma." I said, "Well, do you mask?" "No, sir." He said, "No, sir." I said, "Well, that's why." He don't want you to come and expose your grandma to it. So some people have not yet caught on to the seriousness of it and how we can contribute to making sure that this disease doesn't spread any more than it has. And in closing, I want to say, you know, it's 4th of July weekend. I should have had 2 of these, and we wear the red, white, and blue this weekend. But I want you, in this case, to remember the red and the red flag, because of all these events that are going on this weekend. So don't look at the blue and the white, but see the red. And when you get invited or you see those large crowds, those gatherings, you need to think about that before you go into there. Once again, sometimes it's not about you, but who you're exposed to and who you expose yourself to. So see the red. You know, every event, treat it like that. Treat it like that. If you do that, then I think we'll be in much better shape when we come again next week. So let's do what we can. Liberty County is a blessed place. We realize that, and we thank God for that. We've only had one fatality in our county. We want to keep it that way. But as the spike happens all around us, let's each do our part. I tell young people all the times when it talks about how you make a difference, it's a grassroots at a local level. So what you do is what you do. The CDC can make the recommendations all day long, but if we don't adhere to them, then we're not doing our part to make sure that our community is kept safe. So thank you for tuning in again. We see you same time next week. Have a great weekend and great holiday weekend. Be safe. Be safe.